Hi, everybody. Thank you so much for joining us today. Like was just shared, Ariel and I will do some quick introductions and then we will jump right into our presentation for you today. I do want to encourage you all, please do share your names in the chat. And then as we go along here throughout our presentation, if you have questions, please also drop those in the chat. We will try to stop incrementally and answer those as we go along. So really looking forward to speaking with you today. I'm Susan Butler-Staub. I am the Senior Vice President of Network Impact here at Child Care Aware of America. I spent a number of years working in childcare programs as well as over a decade in childcare resource and referral. So really coming to you from the field, even though it has been a few years since I have been there working in other areas of childcare systems. So I will pass it over to you, Ariel, to say hi and introduce yourself.
Yeah, hi. I'm Ariel Ford. I am for another 2 weeks the Senior Vice President of Program Impact, and I'm so excited that Susan Butler-Staub is taking this role and just running with it. So I am actually going to be transitioning back into the field and working alongside all of you. I get a chance to go back and to my roots and work with kids and families in a small multi-site set of programs in the Raleigh, North Carolina area, doing Reggio Emilia and Spanish language immersion. And I just want to say, Dr. Susie, some of my favorite work is happening in Chattanooga. I was there for 4 years and loved it. So glad to have you here. And then just glad to be a part of this. And I will pass it back over to Susan instead of rambling like a besotted early childhood person.
Thanks, Ariel. So I do want to, let me just, there we go. I want to just share a little bit about kind of what our hopes are and what our plan is for today, so that you can all get a sense of what we're going to be talking about. First, we want to make sure that we give you kind of a brief overview of what it is that Child Care Aware of America does. So we're going to talk about some of the different facets of our work as a national nonprofit and kind of how that bleeds into different organizations around the country. Then we're going to shift and talk a little bit more specifically about childcare resource and referral organizations and what those look like, the work that they do, how to get involved. And then we save some time towards the end for questions. But like I said, please do drop questions in the chat as we go along, and we'll try to pause and address those as we go. Our hope for the day is that you all kind of leave this conversation understanding what the work of CCR&Rs is, as well as what it is that Child Care Aware of America does, and kind of understand how you can reach out, make contact, and engage in some next steps if you're interested. So with that, I'm going to start really quickly with the theory of change that Child Care Aware of America is working from. So the way that we really think about our work is understanding what the kind of the big picture issues are with childcare in this country and how we can support improving that situation. So right now we know that the childcare system in America is really a patchwork of different things. There's lots of different types of care. There's lots of different types of funding. Often it is inadequate funding. And so we understand that that really is holding back everybody. It holds back families, it holds back childcare providers, it holds back businesses who are trying to hire folks to come to work. And all of that rolls up to holding communities back and really impacts the bottom line of a lot of different companies and organizations, as well as really reducing the productivity of the workforce. On the other hand, we also know that having the childcare system not be easily accessible for families and children is denying children the strong start that we believe they all deserve. So that's kind of where we're coming at this work from. We think about the work that we do and kind of how we're moving forward in three buckets. One is our network. And so we'll talk with you a little bit about the network of childcare resource and referral organizations and other early childhood nonprofits that are doing the work of childcare resource and referral. And we'll talk about that in a little bit. But one of our goals is to make sure that that network is very strong, is very engaged with each other, and is really working within their own communities, both locally, regionally, and at the state level to make quality childcare possible for every family within their community, region, and state. The second bucket of our work is really focused on driving policy change and using data to do that. So we both collect data as well as do our own research. We have a whole research arm that conducts a number of research projects that we'll share a little bit with you about today. And we use that to really bolster the advocacy and policy work that we do, supporting folks at both the state level and the federal level to do that work. And then the final bucket that we talk about a lot are helping to identify and deliver scalable solutions that work for families, for businesses, and for government. So really thinking about ways that we can help identify and deliver solutions for all facets and all partners in the childcare system. Through that work, what we're really aiming to do is to create a very strong infrastructure of organizations that do childcare resource referral work so that we can really transform what is currently a fragmented system into one that really does function well. We want to encourage and identify that policymakers at every level, community, state, and federal, adopt solutions that lower the costs to providers, lowers the cost to families, raise quality, and sustain a skilled workforce. And we want families, providers, and communities to have everything they need to be able to identify, access, and utilize high quality care for their children. So that's kind of our theory and how we organize the work that we do as a national organization. And what we're going to share with you now is a little bit more specifically about the work it is that we do in each of those buckets. So I'm going to start with my bucket, which is network impact. So the work of my team is really we really focus on the early childhood organizations that are doing CCR&R work across the country. That means that we are identifying, creating, providing standardized tools, resources that are anchored in our foundational position statement, which we'll drop a link to in the chat for you this afternoon, that really outlines what the delivery of highly effective childcare resource and referral services looks like, what it entails, and how it is done. So that's a big piece of our work, helping childcare resource and referral organizations do their work better, be more effective, and be more supportive within their communities. The second piece of what we do is really support professional development amongst our network. So helping them identify new trends, helping them learn more about the work that they're doing, whether that's consumer education and referral, if it's professional development for childcare providers, if it's technical assistance. We identify and deliver that ongoing professional development, both broadly throughout the year, as well as during our organization's two flagship events, Leadership Institute and Symposium. Some of you may have come to Symposium. It is held in May in Arlington, Virginia, and includes an advocacy day on the Hill to talk about issues in childcare. And then the third kind of piece of what the network impact team does is provide technical assistance to support our local programs. So to support childcare resource and referral organizations at the local level, regional level, and state level with issues they may have. So it could be, we're really struggling to understand how to create a professional development roadmap. Can you help us with that? So my team will provide technical assistance to those organizations, similar to how these organizations can provide technical assistance in the childcare classroom and to childcare administrators. And I'm going to pass it over to Ariel to talk about some of our other branches of work.
Yeah, great. So we wanted to start with the network impact work because it's some of what you probably are most familiar with. So that is where your childcare resource and referrals are providing your technical assistance, your trainings, all of that, your referral services. And so that's what Susan leads up, and that's how she and I met. Is we were both in CCR&R in North Carolina, these many years ago. We don't like to talk about how many. But Child Care Resource and Referrals and Child Care Aware of America also recognize that there are lots of other ways that we can, should, and are impacting the early childhood landscape. And one is through policy advocacy and research. Next slide. So is it, okay. So what we know is that the work you do is critical. It is shaping the architecture of children's brains. It is changing the direction of families' lives because they know that their kids are in safe, quality care. What we also know is that without adequate policy supports, it's really hard for that to happen across our whole country because there are families who are relying on childcare subsidy, families who are relying on pre-K, all of those good things. So we also work in the policy advocacy and research areas to make sure that we have kinds of data that we need to support good policies. We want to make sure that we have the research that we need to support great practices in the classroom and for our CCR&Rs. And then we want all of that to filter up to hopefully impact our local, state, and federal lawmakers so that they support our early childhood system. Child Care Aware of America and the CCR&R network was really instrumental during the COVID response to make sure that your stories were shared far and wide, that the heroics that you are doing every day were recognized at all levels of government and in all rooms. It was a time where lots of people were shutting their doors and childcare stepped up and answered the call and said, our families need us, the nurses need childcare, the first responders need childcare, so we're going to be open. And it just gives me chills to think about that. So CCR&R made sure that those stories were shared along with organizations like you all's. And so we're just really proud of that. So we do have all of these different ways that that you can engage in policy across our network. And Susan mentioned the policy forum, which is in May of 2025, I think May 2nd, 3rd, and 4th, Susan. Very
Third
early
or
May.
sixth. Yeah.
Close. I was close. It's my birthday is May 2nd, so it's normally around my birthday. So that's why. But we encourage you to come to that. We try to make sure that it is a really robust set of opportunities to share in policy conversations, to go to the Hill and talk to your legislators, and just not to be afraid to get into those. And if you're on this call, you probably are not afraid to get into these policy conversations because you know that what happens in your state legislature, in your city council, and in our nation's legislature matters to you and your families too. So we're really proud of our policy work. Next slide. We also know that there's another piece of the work that needs to be addressed, and it's the solutions, what we are calling solutions at scale. Next slide. And what we really think about with this is how do we make sure that childcare resource and referral, and we're going to transition to talking about that position statement in a few minutes, but how are we trying to make sure that you have access to great technology systems and that businesses have access to you as providers? So let's say that there is a new company moving into your town and they're building this brand new tiny factory. And what you know as a provider is, well, there's no infant care in our town. There's 35 infant slots across our whole town, and they're taken up, and there's no more to be had, and they're going to be moving in 1,500 new families. What are they going to do with their babies? So what we do at the local level and at the state level, and what we want to accelerate nationwide and raise up the stories of nationwide is how our CCR&Rs are able to support you all and having conversations with these businesses. And one of the ways is through great technology solutions. So these are the solutions at scale that we're thinking about. This really came from an investment that our military did in the 80s and early 90s around providing childcare for our military personnel off base. So we know in the 80s, they started the on-base childcare programs and they quickly ran out of room and it didn't work for all families. And so they started these childcare subsidies for off-base childcare. Childcare Aware of America is the third-party administrator of that. And it just got us thinking about how, as a network, we could be better at exploring how to support our employer solutions across our country. So those are two of the other. Of course, we have a finance team and a communications team and all that good stuff, but these are the three main buckets of program work that you might be involved with. So that's the piece that Susan heads up around the network impact, which is that kind of bread and butter, the resource and referral services, the technical assistance and training, the policy research and advocacy, and then the solutions at scale. So how do we make this what's happening in your local communities, what's working so well at your local communities and in your state? How do we scale that across the country? So those are the three big buckets that we work on at Child Care Aware of America and that your local CCR&Rs work on too. Next slide.
All right. So sorry, I have a barking puppy. It doesn't bother y'all too much. I'm going to talk with y'all a little bit about position statement that Ariel dropped into the chat for you. And what that position statement really does is outline our organization's kind of perspective on what it is that CCR and our organizations do across the country and how we want the general public, as well as parents, policymakers, decision makers, and you all as providers to understand that work. So the first thing I want to share is a little bit about what the position statement as a whole actually does. So within this position statement, we really are defining roles around community-based childcare as well as state network childcare. And I'll talk a little bit about that just to kind of identify what that means. So when we talk about childcare resource and referral, as with many things, particularly in the early childhood space, the way that it rolls out across the country is very, very different. From state to state, the way that systems are structured varies. And so that really rolls down to the way that CCR&R is done in different states. In some states, we have what we call is a state network. So it's an organization that through some approach, whether it's contracting or some voluntary relationship, manages the work of community-based organizations. So there are child care resource and referral organizations based in local communities. Those organizations provide some level of reporting and data and feedback to a statewide organization that then is a statewide voice for the work. In other states, all CCR&R is community-based, and there isn't necessarily a state network to help coordinate that work. And in just a couple of states, there's only one CCR&R that covers the full state based on population, need, and what's available. So there are a lot of different kind of facets of how this work is done. And so what we really wanted to do is define what is it that community-based childcare resource and referral organizations are doing? What is it that state networks are doing? And how are these things similar and different? The second thing that the position statement does is really assert that the belief of Child Care Aware of America is that every state really needs well-resourced community-based CCR&R and a well-based or well-resourced state network that is, and we're able to put out an achievable goal for how to make that happen. So to try to share with states, particularly with state administrators and those who are running state systems, what it is that can be accomplished when you have a well-resourced and well-networked community of CCR&R organizations. The position statement also really makes the case for comprehensive and integrated solutions that approach the work of childcare in a way that is going to make accessing care really possible for all children and families within a community. So thinking about where some of the roadblocks are to that type of access and how to alleviate it. That may mean a number of different levers, whether it's funding, whether it's programmatic supports, but really looking at how we're creating comprehensive and integrated solutions. Within the position statement, we also include recommendations for policymakers, for state administrators, for the business and community population, and for CCR&Rs to really help them think about ways that they can create really thoughtful partnerships with each other so that they can work together to solve some of these issues and create some new solutions. The position statement also really outlines some of the core services that are offered by both community-based childcare resource and referral organizations and state childcare resource and referral networks. That doesn't mean that the position statement captures everything that CCR&Rs do across the country. It absolutely does not. As with very many other community-based organizations, CCR&Rs have a whole host of things they do outside of their core services. And so as we talk through a little bit about the position statement, we'll identify what some of the core services are, and then a little taste of what some additional services that happen in different places may also be. And then finally, the position statement really supports folks, particularly policymakers, CCR&R organizations, and practitioners in thinking about how to identify, advocate for, and support investment in comprehensive strategies that support the childcare field. So I'm going to share with you just some kind of the basic overview of what it is that this position statement outlines as the three core characteristics of effective community-based CCR&Rs. So these things, one of the things that's very true in childcare as well, these are kind of broad characteristics that may be accomplished in different ways. But if we're going in and looking at the work that a CCR&R is doing in a community, we want to be able to see all three of these things to be able to say that we believe that CCR&R is truly effective. So the first thing is offering full service solutions for communities. So that means that really looking at all parts of the childcare system within a community and how it is they can best support. So that can include helping to build the supply and quality of childcare, growing the childcare workforce, helping both families and businesses solve childcare challenges, and delivering on the ground information and solutions to all three of those buckets of people. The second, and I cannot emphasize this one the most, effective CCR&Rs are truly grounded in their community, meaning they understand not only kind of what the trends in early childhood may be that are happening nationally, but what it is that the community that they are housed in actually needs and how they can develop solutions that meet the needs of their community. So that's one of the reasons why when we see this work in different communities, it looks a little bit different because what works in one part of a state may not work in another part of the state. And even broader than that, what works in one state in our country may not work in another state in our country. So really trying to identify what it is that the needs are in that community, respecting and honoring the culture of the community as a whole, working to build trust among partners in that community, and then identifying how they can best support. And then the third characteristic is that CCR&Rs are mission focused for the public good. So they're offering accessible and inclusive services to everyone in a community. Typically, this means that a lot of, not all, but a lot of services are free of cost or offered at low cost so that we're not creating barriers to to being able to access, whether it's training, technical assistance, other professional development, childcare referrals, all of those pieces within the community. Then I wanted to take a second. I know I mentioned before talking about core services. So in the position statement, we really outline core services for both community-based CCR&Rs and state networks. So I want to talk you through those, and then I'll just take a quick second and talk a little bit about how what some additional services might also look like outside of these. So in a community-based CCR&R, core services include supporting family choice in childcare. So that can often, what that looks like is providing referrals. That may be a web-based referral, it may be a phone-based referral. It could be what we call enhanced referral. So giving deep support to a family to help identify what care is best, but offering some support in that way. It could also mean providing contextual information for families about how to choose quality childcare. What is it that you want to be looking for when you go into a childcare program? What questions might you want to ask of a center director or of a family care provider? what is it that you might want to know as a parent? Because as we know, a lot of parents come into having a child and going into childcare without any previous knowledge. We also want these organizations and believe that as a part of their core work, they, in many ways, build supply, quality, and diversity of childcare options. So that can look like a lot of different things. That can look like providing trainings on opening and operating a childcare business. That can look like providing on-site support for childcare programs. That can look like doing a needs assessment and talking with community leaders about what they've learned about both the providers in an area as well as what families are looking for. Can be a whole host of things in that category. The third, which I hope you all are familiar with, and if you're not, we want to make sure you're familiar with before you leave this call, is that a huge core service of our CCR&R organizations is to grow and sustain a skilled childcare workforce. So this means offering trainings of a whole host of in a whole host of ways. So that can be short-term trainings, one-time trainings, can be in-depth, long-term training. It can be on-site technical assistance, working side by side with a teacher in a classroom to help them build a skill or answer a question, support the teacher in understanding how to best serve particular children, or say you have a teacher who moved to a new age group and is struggling to get used to it. There are folks who help to provide you all with additional support for those classroom teachers. We also have CCR&Rs providing real world data to inform community decision making. So that goes back to this idea about collecting needs assessment, also data about what's going on in your programs. How many programs are there in a community? How many children are enrolled in those programs? What does that tell us that they can then share up with the state about what the needs may be in different communities? So they're a real hub for data, for aggregating data about the child care within a community as well as within a state when we get to state networks. And then finally, for our community-based CCR&Rs, we really, as a core part of their work, want them to be influencing policy and regulations and helping build solutions. So that looks again in a lot of different ways, talking with providers in their community about what is it that's working, what is it that you're struggling with, what are some of the big picture issues that we're facing, and how do we need to identify solutions both locally, state, and federally that will support the childcare system. In terms of state networks, it's very similar. A lot of state networks actually provide community-based CCR&R services. But in addition to doing that, when we have an organization that is working across a state and working with all of the CCR&R organizations within a state, they have kind of another level of core services that they're really working on. One of those is promoting the use of best practices statewide. And so that means really working with all of the community-based CCR&Rs to try to help them utilize best practice in all aspects of their work, in data collection and use, in policy and advocacy, in training and professional development opportunities, in consumer education and referral, that they're doing all those things in the best way possible. The second thing that state networks are able to do is to take all of that data that community-based organizations are collecting and providing, to aggregate that at the state level and then really utilize that at the state level to help bring contextualized information to decision makers, to say, here's really the state of childcare. Here's why we need additional investment. Here's why we need you to be with us on these different topics. We also have state networks promoting statewide awareness of and access to CCR&R services. We often joke that CCR&Rs in many communities are the best kept secret, and that's not really something you want to be. You don't want to be a secret to anyone. So really trying to make sure that the word is getting out about what's available to families so that families know that they're not alone when they're trying to identify and access childcare, that there are opportunities and resources available to them. And then finally, for state networks, similar to community-based organizations, that they're also influencing policy and regulations at the state level and helping to identify and build solutions that really work within their state to shore up the childcare system and make sure that children and families have access to care and that you all are able to continue to provide that care. The last piece I'm going to mention here before we move on to the to our landscape survey is I mentioned before additional services. So we talked about core services here, but just to give you a sense of what we mean when we say there are some additional services, some things that you may see that CCR&Rs may do either at the local or state level are things like providing trainings about or providing supports to employers about how to access childcare for, like, as Ariel said in her example, working with employers to identify opportunities to access or create childcare for their workforce. It could include doing developmental screenings for children, bringing those on site to childcare programs. A lot of CCR&Rs are a hub for programs like Dolly Parton's Imagination Library. So there are a lot of additional things kind of outside of what's in this core service that these organizations are doing based on often what their community needs are and what the community interest is. So just wanted to give you that as well for some additional context about what these organizations are doing every day. And so I'm going to pass it over to Ariel to talk a little bit more about what we know about CCR&Rs in the country and what it is they're doing.
Thanks, Susan. So we learned about some about Child Care Aware of America, and then some about what our hopes and aspirations for our CCR&Rs across the country. And now to share with you a little bit more about what they are actually doing in your communities, and so things that you can expect. Next slide. So we've talked about these services, these core services, and this shows you just how pervasive these services are across our country. So this is, I think that we are missing 3 states in this, and just so it's almost the whole country. But they really are here as a resource for you. So 90+% are providing technical assistance and training, subsidy information, referrals, 92%, professional development, which is inclusive of TN training, but some have community college courses through their CCR&Rs, et cetera, community engagement, and consumer education, which is our referral services and other consumer education on quality, that kind of thing. Next slide. So we know that this is happening basically across the country. What I will say is that other things that you probably need to know are that this is free. Almost all of the place, this is free. It is in almost all of the places they offer more than one language. Spanish is our most popular language, but in some communities it is just determined on that community. So if you have a large population of German speaking, I'm making that up, but you would probably have somebody with that expertise in your community. We talked about working alongside businesses and engaging in advocacy. So this is just an example that the majority of these CCR&Rs are doing that work. We want to make sure that you're connecting with them, because we know a strong connected system between our providers and our CCR&Rs is the best way that we can move our work forward. So this is just a snapshot of how many people are available and working alongside you and on your behalf every day. Next slide. A little bit of demographics. So they range in size. Our CCR&Rs, there is not a one size fits all strategy, just like there isn't for your childcare programs. So there are very small CCR&Rs that have 5 or fewer people. I'm thinking of some of my beloved counties in Western North Carolina, who they might only have, a dozen childcare providers, but there's 3 of them supporting them across their county or their counties. Some are very large with 500 people. I'm thinking about Chicago, Illinois, and San Diego, California. So some of our large metropolitan centers have very big and robust CCR&Rs. Next slide. We're getting the time warning, so I'm talking a little bit fast because I'm like, oh gosh, we had too much to say. Okay, so that's just to say the CCR&Rs, everything that Susan shared with you about the position statement and what our hopes and dreams across the network are, is backed up by what they do in your communities. So what we want to make sure, though, is that our providers are connecting with our CCR&Rs in really positive ways, but also knowing that the resources are in some places more limited. So if you do only have 3 or 4 people on staff, just to recognize that they want to be in touch with you. But if they take a day or two to get to you, that is they are working as hard as they can. All of that to say, the things that when Susan and I talked about what we wanted you all to take away from our time together, there were three big things that we wanted. The first is that you are part of a large national network that is dedicated to making sure that you, our childcare providers, are strong, that our communities and states are childcare strong, and that you have what you need to be successful in your business and your support of your families. Remember, the second thing is that this happens through the programs, the ways that we support our childcare providers through policy and advocacy. And all of this is driven by the real world data. And by this, I don't just mean the number of kids in your program or the number of infants you're serving. And Susan really touched on this, and I'm going to double down. What we care about is that those numbers are backed up by your stories. If it is not backed up by a true story from a childcare provider, and I have said this forever, and Susan and I will preach this from the mountaintop. If the stories don't match the numbers, there's something wrong with the numbers, because we know that you are trying to tell us what is really happening. So when we say data, that is the real world part of it. And the third is that we are promising and committing to you to stay focused on those three things that Susan went over: full service solutions, staying rooted and grounded in our communities so that we know what's actually happening, and maintaining our mission of focus on the public good. We are not here to turn a profit. We are not here to sell you a bill of goods. We are here to support you, our families, our children, our communities, our teachers. And we want a childcare strong country so that we can move forward into our season together. So thank you for your time. I saw that there was one question in the chat from Yolanda. And Yolanda, I'll just go back, and I saw that Cindy had answered. So Yolanda is asking how to maybe get support for opening a 24-hour program in your community. Wow, that is a huge undertaking. Congratulations to you. That's amazing. Absolutely get in touch with your licensing providers. I would also say your CCR&Rs can help you get connected with licensing if you're having a hard time. CCR&Rs also sometimes have resources or mini grants for startup, that kind of thing. So I'd say it's a tag team between licensing and your CCR&Rs. But definitely you want to make sure that you're staying in the good graces of your licensing so you can get open. It's been a pleasure to be with you today. I know we're short on time, so I would love to have any more questions come in the chat, or to open it back up.
No,
Valerie asks.
Yeah.
Oh, sorry, Mariah.
No. I was going to point out, I was like, we have something in the chat. So I don't want to rush y'all. We still have like a good 10, 15
okay, good.
minutes. Okay. So we've got time for questions. I wasn't trying to make you panic.
I was like, oh no, Mariah told me I gotta hurry.
No, go ahead and please,
Okay.
anything in the chat or any of the additional questions that come after, please go for it.
Susan, I'll let you take it.
Yeah.
Valerie's question.
Yes. So Valerie, that is a really great question. And so the answer is a little complicated, but the short answer is yes, it is possible. And that is because there are states in the country that do not have CCR&R embedded into local community. However, that doesn't necessarily mean that there are not local organizations doing similar work. And so I dropped the link to our CCR&R search into the chat. If you look at that and you find that you're not coming up with anything and you're not seeing anything, that is another place where you can reach out to us and we can provide some support. So whether it is that we can help to identify other organizations within your area that are doing similar work, but that are not necessarily identified as a CCR&R, or try to understand how it is that things are organized within your state so that we can point you in the right direction, we are more than happy to do that. So I would say it is possible, but it doesn't mean that we cannot then help you identify some ways that you might be able to access some supports that would be useful. So yeah, Tim, Texas is a really good example. We do not really have CCR&R proper in Texas. The workforce commissions are the closest organizations doing similar work to what it is. I will say one of the things that our organization is hoping to do as we kind of move forward in our work supporting states is to help states who don't have organized CCR&R networks within their communities to, from the state level, understand how to build that out and how they could utilize some of the resources they have to develop those. And in the meantime, we're happy to help try to identify any other solutions we can to kind of help get at some of those service delivery aspects that would be useful to you as a provider. Is there anything you want to add to that, Ariel?
I do because I am since I am moving, got one foot out the door, Susan. I'm going to say, Tim, out loud that Susan and I have a secret plan to bring CCR&R, a not so secret plan now, to bring CCR&R to Texas, because you are a giant state that deserves to have a CCR&R system. Whether that is how, I'm not really, I don't pretend to know where in a state something should be housed, but I do believe that these services need to be in every state in the country. So just so you know, that is on our to-do list, and I'm not actually, I will continue to be an advocate for CCR&Rs on the other side of it. But then also, I saw that Susan Randolph. You're asking how to approach your CCR&Rs in Arizona, and I think we can give you our emails and maybe help you get that specific connections happening.
Mhm.
Mariah, can we make sure to get you
Yeah,
to email out our? Okay.
absolutely. Yeah, I did see that was one of the questions in the chat. Lisette was wondering what emails they can have to reach out to you, but
Yeah.
also Tim did have some things to say, so I have given him
Oh, sorry.
permission to
Great.
speak. So go ahead, Tim, if you want to go ahead and shoot off.
Okay, this is Tim Kaminsky. I'm president of the Texas Licensed Child Care Association. One of the questions I had, and it's kind of a broad-based question. In Texas, we have like 167 plus different childcare related organizations, either advocacy groups or specialized groups. And one of the challenges that our legislators have faced is that everybody is coming to them with their research data. Everybody's coming to them, with their ask and request. And what one of them said to me, they go, it just everything seems so disjointed in terms of the childcare industry and early education in Texas. He's like, I don't know who to listen to. And so, um, as a primary CCR group, how have y'all addressed that in other states as you've tried to bring people together? Because without that common message, a lot of times what happens is everything is fragmented. And so, especially now with funding being so limited, um, getting organizations to message similarly versus saying, well, my information shows this, but I'm in another organization and the information shows the data is this thing. Have y'all come across that? And if you have, how have y'all addressed that in the past?
Oh, Tim. Susan, you should come up. Susan and I can answer this together. So I will start us off and then let Susan take it over. But we are both from North Carolina, which has a very similar landscape. And so I was the state childcare administrator during COVID, while Susan worked at an advocacy organization, and that was a huge problem. And frankly, if I'm speaking amongst friends, our legislators sometimes use it as an excuse to not do anything. They're like, oh, well, so and so told me this, and so told us that. Well, that's not good enough because we were actually all saying the same thing, just maybe with a little bit of different words. So I will say the organization that Susan worked for did a really brilliant job of bringing together all of the advocacy organizations and coming up with a shared policy agenda. We worked together on it with the state. As the state, it's the state, I had to do what the governor told me to do, but we worked with the governor's office to make sure that that agenda was pretty lined up. So no matter who is coming in their door, everybody might have a little bit of their own piece of the pie they were talking about, but those main two or three goals, those first top line 2 or 3 goals, were the same across the agency and the organization. Susan, I don't know what that looked like on the inside for you, but from the outside, it was like, hallelujah, somebody is helping to herd the cats, and we're going to get, and we did get something done.
Yeah. And I think the other piece of that too is really creating, a lot of that work in North Carolina was really focused on understanding communities and getting buy-in from all of the different organizations. And obviously it's nowhere near as big of a state as Texas and not quite 167 organizations that we had to get in line. But I also really think that there are a number of things that for a state like Texas and other states, because Texas is not alone in this, thinking about who it is that the players are, what services it is that they're already doing, and really, and this is one way that we can help as kind of a non-biased organization is to come in and say, okay, can we help do some coalition building? Can we help to identify ways that we can not create yet another organization? Because I am the last person who's going to suggest that, oh, well, we just need another organization to do this work. No, we probably have the work getting done. What we need to do is make sure that that work is coordinated so that providers, teachers, parents are not struggling, and legislators, honestly, like you said, are not struggling to figure out who they should be talking to, what data is the right data, but instead that they're aligned and kind of all singing from the same songbook. And so I think it's a big piece of work, but I also think it's the type of thing that our organization and NCCA and you, Tim, folks in your position at the state level can really collaborate on to say, if we can say, hey, this is what we really think, let's talk to some of these organizations about it. And here's what providers are saying they need. Here's how this is impacting them that we don't have this. This is how this is impacting families because we don't have this. This is what we're missing out on from the legislature because we don't have this, can hopefully help us do some of that work. And so it is a long process. It involves a lot of relationship and coalition building, but I do think that is, to Ariel's point, our hope is that in states where this is not existing, we can kind of come in and help do some of that work alongside our other partner organizations to really try to get something that is much more aligned and easy to access and clear put in place for everybody so that we can raise up the needs of families, teachers, and all of you as providers.